Thanks for joining us today. I am Dina DiOrio, Mecklenburg County Manager. I'm joined today by White Graham, Director of Emergency Management, Gibby Harris, Public Health Director, Meg Sullivan, Medical Director, Raynard Washington, Deputy Health Director, and Police Chief Johnny Jennings. With our COVID cases, hospitalizations, and positivity rate continuing to rise, Mecklenburg County Public Health recommends a mask mandate countywide. They are also recommending that the Board of County Commissioners adopt a public health rule mandating masks indoors across the entire county. If approved, it would go into effect in 10 days. To advance the process, we have called a special meeting of the Board of County Commissioners this Wednesday afternoon at 3 p.m. to discuss the issue, present the proposal, and ask for a vote. In the interim, before the effective date, Mecklenburg County and the City of Charlotte will proceed with instituting individual mask mandates in the unincorporated areas of the county and the City of Charlotte to mandate mask wearing indoors as soon as Wednesday. Each individual town board will decide whether they want to take any interim steps before the effective date of the rule. No additional restrictions are being considered at this time. As Public Health will update us in a moment, the current COVID situation here and across the state is very difficult, with even those already vaccinated still at risk of contracting a less severe COVID case or passing the variant on to the unvaccinated or those susceptible of getting COVID. I will be glad to answer any questions in a moment, but now I'd like to introduce Emergency Management Chief White Graham. Thank you.
Good afternoon, everybody. It's pouring rain outside, so I'm going to take my glasses off because I'm sure I can't see anymore. It's a rough day to be here again, but we have a great team. And it's a team that we've been through this for a year and a half. Since the beginning of this pandemic, we have said that we will rely on the medical and healthcare experts to guide our decisions for our community, and the Charlotte-Mecklenburg Emergency Management will support Director Harris in the Mecklenburg County Health Department in this response. The Mecklenburg County COVID-19 Policy Group, which is a coordinated part of the Emergency Operations Plan that was adopted by all 8 governments within this county, that is led by Mecklenburg County with the assistance from Emergency Management and includes representatives from Atrium Health and Novant Health, met today. It is a recommendation of the policy group that we take additional measures to help slow the spread of COVID-19 in our community. The recommendation was based not only on the current increase in COVID-19 cases and hospitalized patients, but also the steep and alarming rate at which COVID-19 infections are rising in our community. Our community, Mecklenburg County, has shown tremendous resiliency over the past many months, and we know that we will continue to fight this pandemic together. While we know that many people will not agree with this decision, the leading experts in our community agree that we need to take this step now. Furthermore, we need to slow the spread of COVID-19 so we can avoid more drastic and serious measures such as social distancing and economic shutdowns. The Charlotte-Mecklenburg Emergency Operations Center, the EOC, reopened last week in a virtual monitoring capacity to maintain situational awareness and assist in the response to the increase in COVID-19 infections in our community. We continue to work with Charlotte Fire Logistics to provide personal protective equipment and accommodate logistics requests. At this time, I'm going to turn it over to my very good friend, Director Gibby Harris, for her comments.
Thank you, Chief Graham. Mecklenburg County as a whole continues to remain in the red. Both our case counts and our positivity rate indicate that we have significant transmission in our community. Our cases over the last 2 weeks have increased by 87%. We've seen 8 deaths in the past 2 weeks, but unfortunately over the weekend we had 5 more that happened in our community. Over the past 2 weeks, 37.5% of recent deaths were among people aged 40 to 59. 50% of deaths were among African Americans. Our hospitalization numbers continue to be up, both for people with COVID having to be in the hospital, as well as other situations that are requiring hospitalizations. This is stressing our hospitals, but we've been assured that they are continuing to be able to manage, but know that things could get more difficult over time. Our percent positivity rate is at 13%, but amongst our zip codes, it ranges from 4.7% to 17.1%. 50% of our cases are among individuals aged 25 through 39, and 20% of our cases between those 0 to 17 years. Our African Americans are overrepresented in cases at 27.7%, and we have several zip codes that are overrepresented as well. We continue to see some post-vaccination cases, formerly called breakthrough cases. We know that we continue to see this in our community. The good news is that those cases do not represent significant illness, hospitalization, or death, but they do represent the possibility of transmission of this virus in our community. In terms of vaccines right now, we have 55% of our community partially vaccinated. 50% is fully vaccinated. That's great news. Children and young adults and Black residents are all getting vaccinated at higher levels in the past 14 days. That's an overall trend for us and what we continue to seek in our community, as we see that some of our disparities really occur in those populations. We are also getting ready to see third doses being provided in our community. That started today based on CDC guidance and FDA approval. The third dose will be provided to those who have moderate to severe immunocompromising conditions and who have previously received 2 doses of an mRNA vaccine. There will be no medical documentation required. It will be self-reported by the individuals. The Health Department is providing a third dose to eligible individuals starting today. We are asking people to please self-select. If you fall into any of the categories agreed upon by CDC and experts at the national level, seek a third dose. If you do not fall into those categories, we ask that you allow us to continue to get our community vaccinated, at least with first and second doses. And currently, there's no additional dose of any vaccine authorized for individuals who receive the J&J vaccine for third doses. So we will continue to work through that situation with our community. We expect to see an increased demand for doses based on that, and we ask for people's patience as we continue to try to get first and second doses in as well. Several things that I want to point out. Number one, 50% of our population is still not vaccinated. This is a continuing issue for us as we try to get this situation under control in our county. We continue to see disparities in our community, and we continue to see a number of individuals not masking indoors, which has been a recommendation up to this point. We have to recognize the fact that our schools are convening in 2 weeks. All of our children are going back to school, many of whom cannot be vaccinated, half of whom who can be vaccinated have not been vaccinated. So we know we've got a situation that could cause significant issues for us for transmission of this virus in our community, especially among our young people. That's the reason we need the masking in our community, to protect them as they get back into school. We also know we have a holiday weekend coming up, and we've had significant experience with holiday weekends creating increased cases in our community. So the bottom line is we need people to get vaccinated, and we need people to wear masks. Those are the 2 things that are going to help us monitor, manage this situation, and keep us from continuing to escalate in our community. We know that COVID is here to stay. We have got to manage it. Vaccines and masks are going to help us manage this as we move into the winter and back into the spring again.